Hello and welcome. You're listening to Mastering Innovation, our new show here on SiriusXM's Business Radio powered by the Wharton School. I'm your host, Saika Chaudhary, Executive Director of the Mack Institute for Innovation Management and a Professor of Management. Just as a reminder, we're live every Thursday at 4 p.m. Eastern Time, and the show replays a few times throughout the week. Our show focuses on how established firms can remain innovative and handle disruption challenges. We bring in executives, industry experts, and academics as our guests to provide insights from their experience and work with us. Now I'm thrilled to welcome Robert Boland, the Associate Director of Emerging Science and Innovation Strategy at Johnson & Johnson, one of the leading pharma and healthcare companies in the U.S. and globally. Bob, thank you so much for joining me in the studio today.
Thank you. Nice to be here.
It's great to have you with us and chat about innovation, which both of us care about. Mm-hmm. Why don't you just tell us a little bit about what you do at J&J?
Okay, great. So within J&J, we have three sectors. We've got the pharmaceutical sector. We've got the medical diagnostics and devices sector. And we also have the consumer products sector. I'm in the consumer R&D sector. Within that sector, my job, my role now is the Associate Director of Emerging Science and Innovation Strategy within the group. And this team that we've been comprised of right now for over 3 years now, we went through the plan, the build, and the run. We're in the run phase. So now we're executing on our strategy around innovation.
Sounds exciting. So tell us a little bit more about executing on innovation strategies. What do you mean by that?
Okay. We are an emerging science group. So in that respect, we look at emerging technologies, emerging scientific areas. Unlike other parts of the organization, which will deal with mature products and do new and improved, we do emerging science, and we focus on that. One of the key things, though, as we progress through what we call our de-risking process, the strategy will take a scientific area and evaluate it and de-risk it. But what I mean by de-risking is evaluate it from an array of different angles. Make sure that the new scientific area is not being worked on by another company, for instance. We're looking at the patents. We're looking at the protection of the IP. We're looking at the legal aspects. We're looking to make sure that what we're doing is going to move forward and move it from what we would call a de-risking due diligence process into what we would call a catalyzer. We'll get to that in a moment.
Sounds very exciting. Can you give us some examples? Are you allowed to disclose some of these emerging areas you're working on?
Yeah, I think so. It's no secret that the product line within the organization at Johnson & Johnson is very robust. We've got the Neutrogena clean and clear lines. We've got the Aveeno lines. We've got what we call the need states. And the need states comprise baby, beauty, oral, smoking cessation, feminine care, and more coming online. But they're the core. And within these spaces, the emerging science within each of those, what we call need states, is rapidly, what we're hoping to do is change that and transform what we see from an emerging science perspective into the next transformational potential product for the business. So in that respect, cool. Yeah, in that respect, it's a lot of work, and it's a lot of exciting work at the same time. And but we follow the strategy, and like I mentioned before, around the due diligence and de-risking strategy, and that's what takes us from 0 to 60, and then moving that, what we call a concept into an actionable insight that the business can take on and move it hopefully towards into a productization. So the commercialization of that is sort of the last phase that you talked about. Yeah.
How can you de-risk something like that?
It's a process. We go through a 6 to 18 month process to deliver these actionable insights to the business. The de-risking components, we have an array of different talented scientists on the team. And the goal there is each of the scientists within these specific areas, and one of them could be, I'll name a real key one, microbiome and naturals is another one. These folks are some of the leading experts in the industry in these spaces. And the de-risking occurs when they have a concept that comes in to them where they will discover it through research, and then they will go through the process of evaluating it, the technology of it, they'll evaluate the science of it. They will lay a foundation of a plan out to make sure that what we're working on is going to take us to the next step. And also at the same time, we're doing competitive analysis to make sure that we're not doing something that someone else is doing, as I mentioned before.
So it's a really systematic approach, it sounds like it, to something which is very uncertain. How does that work?
Well, the certainty, when you think about the uncertainty, rather, the due diligence process takes you through a step where at the end of that due diligence process and de-risking process, you have a good idea and a foundation that this is going to be something that's going to be definitively different or transformational or breakthrough. We will not pursue it if it was not going to be transformational or breakthrough. And I mentioned before, and I speak about innovation, new and improved is fantastic. A new product line coming up is going to be new and improved. That's great, but that's not where the emerging science and innovation group plays. We, as we like to say, we tread where angels dare fear to tread. We are in a very precarious spot. So we're looking at, if you looked at the, an S curve, an innovation S curve, we're at the very beginning of it. We're at the emergence and emergence and the growth of these concepts. And it's a process, I think, whereby at the end of what I mentioned, the due diligence and the de-risking, once we get to that point, we feel that we are delivering an actionable insight that the business can take on and move forward. So that takes months. And so it's not an overnight process, but it takes some months to do that. But once we're done that, we have a confidence that it will move forward.
So it's really radical innovation, revolutionary innovation that is what you're pursuing.
It is. We don't do incremental. Although the company does do that, and we're very good at that, this group is really geared towards an engine of transformational and breakthrough innovation.
Fantastic. You mentioned the catalyzer. What is that all about?
The catalyzers are synonymous with what I would call incubators. So you're taking a new concept, a new technology, a concept, scientific area, and catalyzation in my mind, and I think one of the reasons we named it this was that it's, depicting in your mind inertia, movement, energy. It's moving from 0 to 60s, I would say. Mm-hmm. And the catalyzers move forward in a project. It is a project. The catalyzers, though, have a catalyzer team built around them. So it's not just a single researcher, it's a team of people that work on the catalyzer. And whoever might have had this concept or brought this concept forward, they are part of that team, as well as legal, patent counsel, and an array of other resources within the organization. So that the catalyzer team works together to move the idea from its fruition to its maturity and then into an actionable business insight.
That's really exciting. I mean, one of the things you're touching upon is how important it is to have that cross-functional approach to the team, right? Very important. Yeah. Very important.
I think a lot of the work that we do, the setup of the catalyzer is very, very important. So we have a lot of stakeholders that are involved. Mm-hmm. And at the same time, you cannot, what's the saying? If you don't plan to fail, you fail. You fail to plan, plan to fail. You have to do this upfront analysis in the beginning, and you have to bring the right people in at the right time. And we have those people. We have a lot of different experts within the field. We have an array of different key opinion leaders and subject matter experts that are able to help us and look at these ideas and move forward.
This brings me to a question that I've been having. You're someone who's a boundary spanner, right? You're used to getting people across organizations to work together. What have you learned about making that successful? I mean, J&J in particular is so decentralized. How do you actually do this?
That's a great question. At the same time, you were working within the confines of, I'll use the catalyzer as an example. For the most part, and I know that Alex Gorski is a big proponent of this, innovation is going to take us to the next level. And we know this as a company. We've been doing this for a long time. But to really focus on this and break down these boundaries. I gave a talk one time, it might have been here, about innovation. And innovation doesn't begin when you enter the doorway of a company, and it doesn't stop when you leave the door of the company. Innovation is a constant process. And what I learned through the years of working within innovation, a person might be within the finance department, they might be within the marketing department, but at the same time they have a responsibility of innovation, and they should have a responsibility for innovation. In other words, what could they do within their space to augment or supplement a process for innovation within the entire company? So if you think about a marketing a resource or a finance resource, they might not think day to day that they're innovative. They might think, well, the innovation people, they do that over there. And the technology people, they do that over there, and I don't really do that. But what we're trying to do is break down these walls and make people understand or help them understand that innovation is part of your job. You should come in thinking about how you can change things, how can you make things better for patients and consumers and what we do as a business.
Do they have special incentives to collaborate in this fashion?
That's a good question. I think we get paid for what we do as a job. But I think the incentive comes by way of it's a reward that you are working with other teams. Yeah. You're learning from other teams. And I think a big thing about this, Shaikat, is that when you cross these boundaries, I think what we do and how we do it within a company, and I mentioned it before, patients and consumers, is really taking that the health and wellness of the consumer and the patient into mind. And I think in my mind, that is a reward. Mm-hmm. If you're able to drive something forward and help people, that is a reward. There are awards, though, for science and achievements within the company. There's different levels of these awards, and obviously the highest one is the Johnson & Johnson medal.
Yeah, and that makes sense. There's sort of intrinsic motivation, like you were talking about, mission-driven innovation. A lot of companies are doing that. Then there's sort of the extrinsic stuff, and it doesn't always have to be about money, right? I mean, your recognition and impact are two very important sources of motivation for people.
Yeah, I think from being in the company now for 5 years, I think that you find that the culture of innovation is quite there. Yeah, I think people are energized by what we do. Yeah, I think the old I guess you out of bed every day. I think for me especially, coming from my background, I really want to help people. Yeah.
I think that's a noble mission, and I know that as a company, being also so large but also long established, you really have that as part of your mission. I mean, that's quite exciting. One thing I wanted to ask you about is, data plays a big role nowadays, right? Yes. And how we go about innovating and informing that process that you talked about. Yeah. How do you see it play out? What are the kinds of things that you guys are doing on the cutting edge?
Interesting that you brought this up. So right now I'm working on a working group that's geared towards the consumer R&D data strategy. And the initiative around this is how are we going to work with the tsunami of data that we're seeing coming in today? The promise of machine learning, the promise of artificial intelligence is here now. We've heard about it for a number of years, but I think we have the tools and technologies to do this. The goal for us within our consumer data strategy is to really think about how we can connect solutions together. How can you make a connected experience for a customer or patient? How are you driving that experience? And I use the word experience a lot, and you'll hear that from time to time. The goal there is the data that you're working with today, real-world data, real-world evidence, these types of data that come in from what I call different channels that are not ordinary, the metadata that comes from a usage of a product, for instance. We're trying to capture that and use that in a definitive way to actually make sure that we're engaging the patient and the consumer in a new way and making sure that we're able to sustain that engagement. And we have a arc, if you will, of the consumer right now. I'm working within the consumer space. So you've got, this nice cradle to grave type of philosophy. We could be on the campus of Penn today, and as a student, and you might pick up a product from the company, you might use it. Yeah. It might help you. And as you grow older, you might get married and have a family, and you stay with the product line. You might have a baby at that point in time. You're still staying with the product line. So we're looking at making sure that the data that we get today from a patient and consumer perspective is integrated with a connected solution approach, and it all is geared towards the experience of the person.
So is that like an app, or are you talking about some other way of connecting? How do you remain connected?
Well, it's not so much an app. Although apps are built to do these things, to ingest data, the data that I'm talking about in the real world evidence and real world data, you're building certainly applications on top of a lot of mobile technologies today, and you've got a lot of different ways to interact. We do it today on Facebook, and we do a lot of different things on Twitter and Skype and LinkedIn, things like that. What I'm talking about is how do you use the data in a real way that engages the customer and the patient, that enables you to enhance the experience and enhance the product, the use of the product. Applications have been around for a long time, and mobile phones and apps like that, and different devices have been around a long time. It's the connection of how you make that experience real for that person using the data, and that's not easy. So you were talking about machine learning, and we're talking about artificial intelligence. Yeah. You're talking about using these types of new not new, but these breakthroughs that we've made in these areas to learn how someone is using a product or how they're using a potential product from the company or a drug that we know of. We're also using it in ways that we will be able to predict also what's happening with either a consumer or a patient. These types of things don't just get made. These things take a lot of time and research, but at the same time, we're working with product development and marketing to find a way to cohesively connect the solutions that we create with the data that drives that experience.
Wonderful. I mean, you were talking about data and connected and all of this. So it sounds to me that you're creating an ecosystem in some sense of all kinds of stakeholders, both internally and externally, in order to drive forward this innovation. Is that right? The image?
Yes. What you would call an ecosystem. We're talking about the bridging of the internal and external. So if you're driving towards, I think your question, if I catch it right, if we're trying to see how are you ingesting data, how are you using data, and the data comes in from multiple channels. So I'll give you an example. We have a Neutrogena light mask, which is a product that we have out on the market right now, and it looks towards relief of acne and rosacea. Now, it's a mask that is used today, but for the most part, it's a one-way experience. You're putting it on and you're using it, but not much comes back from the customer in possibly an Amazon review or some kind of website review that they loved it, and it's actually a very, very good product and it's really taken hold in the marketplace. The idea would be to make that an intelligent mask. How can you make that an intelligent data ingest mechanism that you are able to detect usage, detect non-usage, detect other things around the use cases that we have within the mask, and also using the idea of imaging. So if you were able to take an image of a before and after picture, say of a customer, using this kind of this technology, that is a big thing because you can see the improvement over time, and that improvement, if there's some privacy issues here, but if the customer is willing to post or put that data out there, other people who suffer from this can actually see the difference. And it's beyond the 4 out of 5 doctors say, in my mind. It's really showing proof of something that really works. Now, to make that happen, you have to have a mechanism to bring data in off of the device. It just doesn't come out of the box like that. Today, we're looking at ways to actually do that and bring the data from that light mask to a level where we can actually use the data, use predictive analytics around that data, use some real good algorithms around it to actually enhance the experience of the customer. And if you do that, you could do that for an array of different products and what we would call connected solutions. And you can connect these solutions and what I would call, bridging the gap to the internal and the external. You are bringing in external data internal and using the engine within the walls of the company to analyze that data and then make that experience much more robust for the customer and or patient.
Wow. I mean, that's such a sophisticated approach. We often hear about, like you hear too, about data solutions, but they're all very much superficial to some extent, right? And now you're coming at this in a very sophisticated way, beyond the app, right? And,
it is beyond
really
the app.
Thinking about how you can improve lives, but also take and integrate all that data to use it positively. Yeah,
I think what I would say is data's always been there. Big data's been around for many years, but it's how we're using the new tools that we have at our disposal today to analyze and use predictive analytics and machine learning and artificial intelligence to make that data much more of what they say data is the new oil, make that much more of a valuable tool so that we can turn it around and use it within the product lines and make them, again, connected.
Makes sense to me. Yeah. We've talked a lot about looking inside the firm, right? And how you do things. I know you're a big believer in open innovation as well. You work with us at the Mac Institute, but also other places. How do you think companies can leverage the outside ideas, and what's hard and what's have you learned about managing that process?
Yeah. Part of the role that I have now is evaluating and working with companies that bring ideas into the company. So, for instance, if you were to look at, and we have innovation centers around the world that work with these startups, when you evaluate something that's brand new, it's something novel, something totally different, you're going to do obviously a good evaluation of that product. Now, not everything. I think the old saying of if not invented here, it's not going to go anywhere.
Yes.
I think Johnson & Johnson has broken that barrier many, many years ago, that we know that we cannot stand alone. And I talk about these when I talk about innovation at various forums. But the picture has changed now, where we just don't stand alone in the middle. Now we are actually a player within the space of an ecosystem of open innovation.
Yeah.
And I think open innovation has been proven. I know that you speak upon this as well. I think the model is proven. I think what the key would be is do the ideators out there who are in the external world understand our problems enough to make sure that they're working on something that means something to us. So, for instance, there is a consortia that I'm part of. It's a very interesting consortia. And this consortia will bring ideas in, and at the same time, they're researching these people are researchers in their own spaces, and they will research a focus area. It may mean something to a company, say like Lockheed Martin, but it won't mean anything to us. But when you take a step back and you think about it innovatively, it on the top of the app surface, it might mean something to Lockheed. But if you get under the hood and we talk about what algorithms are being used on the data, then it becomes a different conversation. Those algorithms might play for us as well. So when you think about it, you just don't want to take an idea and just quickly put it to the side. You want to really evaluate it. From an open innovation perspective, I think from startups to legacy companies that have been out there, I think we're really starting to work more and more now. I'll give an example. I'm working with Microsoft. And how can Microsoft drive what we're trying to do from a health and wellness perspective? And I think all the companies get it now. I think you've seen this trend now that open innovation is probably not going to go away for some period of time.
Yeah.
And I think you're only going to see more of this. As I said, we have the innovation centers around the world. We have JLabs model around the world. If people are not familiar with that, we can get into that.
Yeah.
But at the same time, the open innovation model, I think, is one that we are actually trying to accelerate through.
Yeah.
Yeah.
So I'm very interested in the Microsoft example that you used. Clearly a different company coming from the software arena. You guys have a long storied past.
Yeah.
The cultures must also be very different, right? How do you collaborate with partners of that sort?
Well, Microsoft has their own health and sciences division, so that's where we really kind of the rubber hits the road. We're not totally thinking of bits and bytes with them. We're looking at different solutions, and they have point solutions. They have customized solutions. They also have an ability to work with us and develop new solutions. So I can't give a lot away there, but that's really a focus for us right now. Like working with these legacy companies, IBM Watson, for instance, could be a player. How do we engage now with those folks, and how do we work with them in a constructive way? The doors have never been closed.
Yeah.
But now I think they're more wide open now from an open innovation perspective.
Yeah, and there's an element of co-opetition too, right? I mean, aren't there common challenges that the industry faces too?
Yeah, there are. The whole idea of the quality of data, right? So Transcelerate is a consortia that was actually born here in Philadelphia, and that actually is interesting. It's comprised, I think now, when I was working with it, around 10 companies. And everyone got together, like the heads of the companies that were part of the consortia, and understood that, the quality and the standardization of data was not taking the industry where we wanted to go. So in that respect, the commonality of working together to harmonize data and make it more clean and make it more quality driven was one of the key things of the actual consortia in one of the early years. In that respect, I think that is the old saying, rising tide floats all boats.
Yeah.
If you can commonly figure that out, then you can obviously work together in a non-competitive way and go forward from there.
I think that makes a lot of sense. I mean, if you look at it, just even on the drug development side, 10 years, $1 billion investment, lots of uncertainty about whether it'll pan out, right? That's not something on the consumer side, but it's a risky proposition. There must be better ways or more efficient ways of doing it, right? To also help mankind. And I think what you're alluding to is that we will find those processes.
Yeah, I think so. I think it's only a matter of time. I mean, people are working on it today as we speak. It's an active engagement process that we go through. Plus it's a nonstop type of process. We're not going to stop. If we hit a wall, we try to go not around it but through it if we can, from a technology perspective. But I think if you think about people, process, and technology, we've got some very bright people on both sides of the fence, both external, internal, collaborating, working together to drive that through.
Mm-hmm.
Yeah.
A final question on that front. I mean, you were at Merck earlier, right? Which is a competitor, but at the same time, like you're saying, when you talk about these consortia, you guys work together on various things too. I mean, do all these pharma companies work in the same way, or are there differences?
There are differences. There's differences within culture. There's differences within processes that they follow. But at the same time, there's standards that we follow together. Now, I remember working with Pfizer and Merck on a consortium some years ago, and it was around data standardization, and it was around how we can get the systems that were working together within a collective group that was part of a project. That the data formats were all different, and we needed to understand how that was going to work, and then we actually had to harmonize the data. Now, if you take it up a level, you've got different philosophies of I'll use culture in a way. When the difference between when I was within Merck Research Laboratories to the Johnson & Johnson pharma side and the consumer side, to me, they're both great companies. They're outstanding companies within the industry. And what I was trying to understand was, and one of the reasons I was making this move is to learn more about how the industry was working. How are they being innovative, and could I use the tools that I know how to use and move it forward into another company? And that's what I was successful at. Now, when you look at Merck and you look at Johnson & Johnson, two basically behemoths within the industry. The cultures are alive and well around innovation, but I think at the same time you look at how Johnson & Johnson might pursue an innovative idea, and you might look at how Merck pursues an innovative idea. Might be a little bit different, but at the end of the day, there's common themes that run through the way that they look at these. For instance, crowdsourcing. Crowdsourcing is a big component of the way that open innovation is done today. Both companies use that.
No, it's very exciting, Bob. We could go talking on and on about this. I think that there's a lot, but I've learned a lot from you. I mean, I love how you've been able to take the best of multiple worlds, bring it together, think internally and externally, focus on the mission. I think there are a lot of great things you guys are doing, and it's wonderful to have you. So thanks a lot for joining me here in the studio today. It's really wonderful to have you. To all our listeners, you can find out more about what Bob is up to and the kinds of things that he's working on in his on his LinkedIn page. He keeps that up to date. I'm your host, Saika Chaudhary, and this is Mastering Innovation on Business Radio, powered by the Wharton School on Sirius XM 111. Thank you.